How would you summarize in one sentence, based on everything we've discussed today, what longevity specifically has to do with teeth, or rather, what significance can be attributed to it?
Longevity, as optimal long-term health and thus quality of life, is essentially the goal. And the dental jaw system simply plays a key role in this, an important, often underestimated significance. That's the point, and since we happen to come from this field and know it quite well, with a lot of experience, we know that we can contribute disproportionately to longevity. Thankfully, it's truly a wonderful thing. And we often experience this with our patients as well, because they simply report it to us. And we've also conducted our own studies on this. After comprehensive restorations, following a biologically holistic, metal-free approach, patients not only experience more joy in life thanks to improved dental aesthetics and perhaps better chewing function, but of course also because the entire inflammatory and infectious burden has been eliminated from the body. And they simply have a much better and easier life.
Welcome to Longevity to Go. I am Dr. DR.BAUDER, and this podcast is aimed at people who bear responsibility. Entrepreneurs, decision makers, and creators. People who have built things up and are doers, and who understand that energy is the real currency. At 30, intensity is compensated for. At 45, intensity is balanced. Your longevity is my approach to sustainable stability and sovereignty for decades to come. With the pillars of health, wealth, and privacy AI, biological regenerative capacity, economic clarity, financial stability, and conscious wealth creation, digital sovereignty. In this podcast, we connect these levels. We talk about systemic health, about structural prevention and resilience in the nervous system, stability in metabolism as well, clarity in decision-making, and protection, cognitive resources. The conscious building of wealth as a form of freedom, and the intelligent use of AI as a tool for clarity, structure, and self-determination. Longevity arises where systems are consciously designed. It's about building and further developing your strategic life architecture. Longevity to Go is part of a bigger whole. The BioLongevity Alliance is a curated network with clear standards. And our Longevity to Go membership is an accompanying framework for everyone who not only wants to understand, but also to implement. Podcast Alliance membership, a system, an integrated system for sustainable stability. Every episode begins with a central question. What does true longevity mean to you? Not just living longer, but remaining powerful in the long term, clear in business, biologically stable, and winning digitally. Health, wealth, privacy, AI, that's Longevity to Go. Silent root cause, an exciting topic that revolves around inflammation in the broadest sense within our bodies. Today, on our Longevity to Go podcast, which focuses on health, wealth, privacy, and AI, I have Dr. Robert Bauder with me. Hello, Robert. Hello. Today, we want to take a closer look at this topic for you. Robert has written a book, Silent Root Cause. What exactly is this book about?
As the name suggests, silent root cause. So the silent underlying root causes, in a way, the actual causes that quietly lie beneath. It's basically about silent, hidden dangers that are not immediately obvious. These are essentially risks that pose significant health threats. And the oral cavity actually has quite a lot to do with it. It's an original area of expertise. As a holistically oriented biological dentist and sports dentist, and it's about understanding the entire systemic connections. Scientifically grounded, but also presented in a way that's easy to understand for therapists of all kinds, and ultimately for ordinary people as well, comprehensively both in detail and in the big picture, so to speak, to provide an overall perspective, simply to impart knowledge, because knowledge is basically the foundation for taking things into your own hands and acting responsibly. Ultimately, the goal is to enable health autonomy so that everyone can take their health into their own hands as much as possible.
These health threats, I'll just call them that, can be very frightening. I'm actually affected myself because I also have, or had, Nico lesions in my jaw. Had. What specific advice or recommendations would you personally offer to an individual who might be affected if they suspect, discover, or are perhaps advised by their primary doctor to have a medical concern like this thoroughly examined and checked out?
First of all, I'd like to address the term threats. such a threat, I just want to move away from these negative perspectives. Ultimately, it's about how we can best organize health. Yes, there are positive and negative factors, and I just hate all this fear-mongering and constant negativity. So ultimately, yes, there are threats. You could define it that way. There are negative factors. Ultimately, it's mainly about what we can do to set everything up in the best way possible so that we are as healthy, inflammation-free, and stable as possible. So to speak, to be able to go through life and have maximum quality of life and maximum longevity. But there are imbalances that can lead to certain problems and can also cause certain diseases and chronic burdens, which in the oral cavity, of course, can have very, very significant effects on overall health. And ultimately, it's also about classifying things objectively and without panic, and also presenting solution strategies. You mentioned those affected. Many people don't even know that they are affected by one thing or another, especially when it comes to silent issues. In the area of silent inflammation, and it's about diagnosing these, presenting possible solutions, and also organizing measures that ultimately lead to a resolution or elimination of these stress factors. So, relaxed but thorough diagnostics, careful consideration, and understanding of the overall context are the foundation before making any hasty decisions about invasive measures. So, diagnostics, assessment, and a holistic approach are always the main focus. And then it's about carefully choosing the right measures, taking into account each individual's life situation and weighing things up on a case-by-case basis. And then to carry them out optimally without panic and without creating a sense of threat.
Over the past 30 years, coming from classical dentistry, you have expanded your educational and professional spectrum as well as your practice to include biological dentistry, sports dentistry, and today you speak of biolongevity dentistry. What exactly does that mean? Where, so to speak, is the distinction or the expansion of the spectrum here? What can a listener understand by that?
Well, many of these terms are, of course, somewhat relative, strictly speaking. Actually, there is only good dentistry, and good dentistry is always holistic, cause-oriented dentistry. That inevitably leads you really to what is called biological or biologically holistic dentistry. But even that term is actually not protected. That means, I just want to say, you could argue about it, about terminology or staking out claims, biological dentistry, holistic dentistry, conventional medicine. Implantology, paradoxology, ultimately all of this is just the artificial creation of boundaries. It's obvious the world is always holistic. We are an open system. Our entire organism, our society, our lives are always open systems. The same goes for our bodies, our oral cavity, our digestive tract. And logically, any meaningful health-oriented longevity medicine or longevity lifestyle is, of course, always or must always be holistically oriented, because as the name suggests, if it isn't holistic, it would be incomplete. And who would want an incomplete view of things? That's perfectly clear. So good medicine must always be holistic. Good dental medicine, as the name suggests, dental and medicine are two very important components. Then of course this too must be holistically oriented. And the question was, yes, this term we coined at long-term dentistry, yes, it naturally includes that as well, because ultimately it is fundamentally about enabling a healthy long life. And yes, for that you need a healthy bite, not just for eating, but also for social communication, for your sense of well-being, for a healthy, radiant smile, and for overall comfort. And of course, that's also the case here. A holistic, biologically oriented dentistry is, in essence, inevitably a longevity dentistry. It is prevention-focused, aimed at longevity, designed for maximum biocompatibility, maximum durability, the preservation of structures or optimal reconstruction, and then ultimately maximum longevity. And we must do everything to ensure optimal, healthy longevity in the oral cavity with our teeth and our overall function. And here I'm talking about decades. And for that, I have to take all these factors into account, including ultimately the environmental factors. And all of this, when brought together, ultimately unites in what we have termed biolongevity dentistry.
Isn't it also the case that the complexity of the entire medical field leads people to think in silos, to say, this is classic, this is perio, etc.? When exactly did you actually start to realize for yourself that dental health always has to be considered holistically, and that, in the end, It is a complex system that needs to be understood in order to provide the best possible intervention?
Well, it became clear to me relatively early on, even during my studies. It's also the case that in the basic medical sciences, the holistic connections are actually fundamentally explained as foundational sciences. I'm just thinking of biochemistry or physiology, for example. The only problem is that the more specialized a field becomes, the more isolated the perspectives become. And that leads to the point where you can't see the forest for the trees anymore, or you lose sight of the whole landscape. And that's exactly the problem. Of course, sometimes you have to look at the tree, the very last leaves, and every single needle. And of course, you also have to analyze and understand the pores of the leaves in detail, but ultimately, we must never lose sight of the bigger picture. And that's a bit of the problem with specialized medicine, and of course also with so-called guidelines or so-called science-based foundations, which are always very, very selective and nowadays are also heavily influenced by economic interests, to put it kindly. There is certainly a problematic mix here, which over time, through educational institutions and what is considered normal in society, leads to certain shifts in reality. And that is in itself a problem, or rather, let's say, a fact that one should be aware of in order to better put things into perspective, to put it very mildly.
These shifts you're talking about are also very much related to the fact that people are constantly confronted with challenges or have to face them. How specifically, or where do you actually see the point where you would say that dental medicine is inevitably and directly connected to a person's performance and, of course, their quality of life?
There are, of course, quite a lot of them. Points of contact or overlaps, that's quite clear. So, for example, chronic inflammations are energy thieves, performance saboteurs, and a chronic stress factor, not just for energy production, but also for subjective and even mental enjoyment of life. But of course, they also serve as a basis or contributing factor. For many chronic systemic diseases, they naturally play a huge role as well. But of course, also a certain freedom from symptoms, or simply the ability to chew or unimpaired maximum quality of life. We are talking about social communication, longevity, smile. In other words, the awareness and the fact of being able to laugh freely, beautifully, and safely is, of course, enormously important for generating one's own self-worth. You should know that from a psychological or psychotherapeutic perspective. It's obvious we all want to, or really should, have a positive self-perception. And it's simply something that's been ingrained in us through evolution. It's in people that interpersonal communication, of course, unconsciously plays a central and important role. Everyone knows the power of a smile. Or if you can't smile, you shouldn't open a business. That's obvious too. Even the Chinese proverb says so. It's simply a law of nature. But it's not just about business. Ultimately, it's also about being able to have a joyful, cheerful interaction with one another. And yes, the power of a smile is an essential part of that too. That's just how it is with humanity. And indirectly, it's the same with animals too.
Statistically speaking, there is a large accumulation of typical widespread diseases around the world that persist, whether it's heart disease or others. Of course, right now, cancer is massively on the rise, and then, of course, there's also the issue of neurological diseases. What I'm missing somehow is, where does it come from? That means, on the one hand, it's about identifying the cause and ultimately what measures I take. What answers could you offer here from your area of expertise?
I think before we get into the specific field, maybe let's take a look at the bigger picture. Of course, most of these things are fundamentally related to lifestyle factors. Naturally, there are also a few other things that have come into play in recent years, without going into further detail here. And ultimately, lifestyle factors are something we have control over ourselves, especially when it comes to chronic diseases. They are crucial. So cardiovascular diseases are mainly influenced both positively and negatively by lifestyle factors, such as diet, exercise, simply lifestyle factors, as they are commonly called. And yes, this also applies to dental and oral health. Are similar lifestyle factors also crucial here? So simply your daily habits, diet, toothbrushing routines, and consistency in early detection and early treatment are crucial for dental and oral health. And dental and oral health also play a very significant role in connection with chronic systemic diseases. in both directions, by the way. For example, periodontitis, as a typical widespread disease, as you put it, originates from the oral cavity. So roughly speaking, about half of all adults and older adults basically have at some point mild, moderate, or even severe periodontitis. So more or less every second person, give or take. Caries is actually the most common disease of all. That means in all forms of chronic disease, which are caused by chronic imbalances in certain everyday lifestyle factors, and which we would therefore also have in our own hands to improve ourselves. That's really important. And to put it simply, you could say that similar lifestyle factors, for example, poor nutrition, what that means we can discuss further, too little exercise, obesity, insulin resistance, too much sugar, low in fiber, and so on, which also cause the major widespread diseases in the entire organism. So obesity, prediabetes, conditions, diabetes, and with that, cardiovascular diseases, neurothelium, degenerative diseases, but also joint diseases, arthritis, arthrosis, and other things. And of course, chronic intestinal diseases, cancers as an independent disease or as a consequence of other factors. These negative lifestyle factors, which significantly enable the development of these diseases over long periods of time, are also similar, partly even identical, factors that cause the chronic widespread diseases of the teeth and oral cavity as well. That is, those that lead to the development of caries, periodontitis, gingivitis, and so on, with all the resulting consequences, consequences of consequences, therapies for consequences, and so forth. Essentially, these are the same factors. As mentioned, most of the time it is diet related. For example, frequent sugar consumption is not only bad for your teeth, as every child knows, of course. If you look at it from a metabolic perspective, unfavorable insulin resistance decreases, obesity increases and ages, end vessels deteriorate, epithelia worsen, endothelial dysfunction occurs, or the wrong fats, trans fats, and so on. Too little omega-3 fatty acids, all these things, or a deficiency in trace minerals, a lack of vitamins. All these things lead to chronic systemic diseases and also to dental and periodontal diseases, which in turn promote systemic diseases and certain systemic metabolic imbalances, such as metabolic syndrome, obesity, insulin resistance, high blood sugar, and so on. These also favor many dental and periodontal diseases or peri-implant disease forms, a very close-knit interconnection. Of course, it is often forgotten that neurodegenerative diseases are always part of this triad as well. That means there are almost always similar, sometimes even identical causal factors that significantly shift the whole situation in a negative direction. And over time, this leads to these chronic derailments, which can also result in severe, sometimes problems that then appear acutely can also become emergencies, usually as a consequence. But the good thing is, if you look at it positively, there's no need to panic. If you improve these systemic factors through know-how and lifestyle discipline, you could get the whole thing under control at its root. In theory, it would be that simple.
Of course, it all sounds super simple. But very often I think people have the problem that they think, I can't afford to eat healthier or to take better care of myself because by now everything has become very, very expensive. What would you say to those people who ultimately have to overcome these economic challenges?
Yes and no. So on the one hand, I completely understand that, of course. We're all affected by rising prices. I think the basics like getting exercise and eating healthy to a certain extent can actually be managed quite simply. For example, a 1 kilo pack. A kilo of organic oats is enough for several meals, at least in theory. You could try things like sauerkraut or sweet potatoes or even some local apples, for example, along with many other similar options that are available. So not everything has to be very expensive. And especially when it comes to fitness and sports, the best exercises can actually be done on a simple yoga mat, which might cost 28 euros and will last for years. It's really a question of lifestyle and priorities, what you choose to spend your money on. And if you know the right things and organize them with a certain amount of discipline, theoretically, if the will is there, you could relatively easily create a healthy diet and a healthy lifestyle. For example, you can completely cut out cigarettes and alcohol, which would save you a lot as well. Of course, there are always many factors involved, but in theory, it would actually be possible, especially when you consider what people spend on other daily expenses, on entertainment and distractions. So I think if you simply redirected that, you could actually make quite a positive difference. And a toothbrush actually lasts quite a long time too. And even a tube of toothpaste with hydroxylapatite in it isn't exactly expensive, and it still lasts. It still lasts maybe 3 weeks or something like that. And if you give up one or another supposed indulgence, which might also cost you, that's actually more beneficial. So things don't always have to get out of hand. But of course, prevention is the cheapest, most effective, and best option, especially in this regard. Biologists, shabby dentistry, because it only gets expensive when things are already damaged and then have to be repaired at great expense. That's when it really gets expensive. And that's why it's so important to inform people about how to actually prevent these costly damages at their root. The cheapest, best, most ethical, and highest good is always true prevention at the root cause.
That means longevity, in short, is not something that only concerns the elite or is just for the elite. Rather, it starts with each individual in their everyday life. And if you break it down very consistently and simply, it's achievable.
It's achievable, and you don't have to be super strict in the sense of being a perfectionist nerd either. It's more like an 80-20 rule, meaning if you do 80% of things right and 20% not quite as strictly, that would basically already be enough and is probably more realistic in everyday life than aiming to be totally perfectionistic. You want to do absolutely everything right. And I think the challenge is, even when I say it from an economic perspective, to leave out unnecessary nonsense and focus on the essential things. Yes, that also requires financial resources, but then it's possible again if you leave out the frills, and I believe you can really make a big difference that way.
In one of our episodes, we also talked about how medicine in itself is so complex for most people that they usually put on blinders and don't really want to deal with it. How would you now explain to someone, or maybe even to a small 3-year-old child, the deep connections between longevity, dentistry, and of course the vital body relationship, that essential body connection?
Well, can I explain it to a 3-year-old child? I don't think I can explain it, but let's be realistic. Maybe from 6 years old or older, because the factual understanding is probably better at that age. In fact, it's really about the fact that life habits are established relatively early in life. And of course, a certain upbringing or leading by example or simply through lived reality is about implementing the right things, because humans are creatures of habit and are socialized in a certain way. So that's already essential, I think, in general. Nutritional guidance naturally begins in childhood, of course, even with 3-year-olds and probably even earlier, but it's hard to explain things factually at that age. But if you really want to explain it factually, I think in childhood, through the establishment of healthy habits and proper or beneficial eating patterns is, of course, a fundamental cornerstone for one's entire life. Absolutely, and naturally for the teeth as well, but that's just a side issue. It's also important for the metabolism itself. And I find that very, very important. It really ought to be a school subject, strictly speaking, because nutrition and a certain degree of enjoyment of physical activity and so on are truly essential. It is truly essential for a person's metabolic imprinting. Of course, you can still turn things around and improve everything later if things have gone wrong, but it is, of course, many times more laborious and difficult than if you set things on the right track from the very beginning.
Could you maybe give me an example? So let's assume now that the patient or the client or whoever, the person, takes a piece of chocolate and eats it. What happens then? Why does this affect the teeth? Why does it affect the entire organism? Where does it stop? Where does it begin?
Yes, of course, that involves many things. It's about a reward system, serotonin, and so on and so forth. I'm not at all an opponent of chocolate. I'm actually a big fan of it myself. Of course, you always need those reward effects, and it tastes good too. It's a luxury food. Enjoyment isn't bad at all. It's only bad when it becomes compulsive and excessive. It's simply bad because, of course, chocolate itself isn't inherently bad. It's not a natural food. It has too much sugar, unless we're talking about some kind of chocolate with 90% cocoa content and hardly any sugar. Then it's still okay, but of course it usually has too much sugar. This leads to blood sugar spikes, followed by insulin spikes and so on and so forth. In moderation, none of this is a problem at all. But if you get used to consuming too much sugar or consuming it frequently, your metabolism gets a bit messed up at first. Overall, even in terms of the training effect, what is normal, what does the body need? That's why you should make sure not to establish this habit too much in everyday life. It's not just about chocolate, and of course it's really bad for your teeth. If you assume that someone eats sweets more often, like chocolate, for example, a child, especially baby teeth, are very, very susceptible to cavities. And that's what this is about. The constant exposure of the mouth environment to sugar, right? The optimal diet for cariogenic bacteria is one where they can locally metabolize sugars into acids, which ultimately leads to cavities forming in the teeth. It's simply a matter of balance again, too often, for too long. Exposure to sugar simply creates a cariogenic environment. If you then also assume a typical, rather mediocre level of oral hygiene at home, statistically speaking, it's simply not perfect between the teeth. Brushing is done perhaps too infrequently, too carelessly, or not thoroughly enough. And this combination of, on the one hand, plaque bacteria and on the other hand, regular sugar intake simply creates a cariogenic environment. Apart from that, if an organism receives too much sugar too often, if too much is supplied to it, it actually leads to a demineralization of the entire organism. So various biochemical mechanisms are also at play there. Essentially, they're all moving in the wrong direction at the same time. So there are many factors that interact here.
What I would be interested in now, since we're also talking about effects that ultimately arise due to the oral environment or the chewing process, is what are the typical complaints or pains for which people, for example, in recent decades, have come to the practice, but which didn't actually start in the jaw?
So are you referring specifically to pain problems that are not localized in the teeth? Exactly, that's right. That actually goes more in a holistic direction because, of course, you have to set things straight a bit. Of course, most people initially come because of some subjectively perceived dental problem, whether it's something simple like a toothache, something breaking off, or any other perceived issue, or a gum infection, bleeding, a loose tooth, a broken tooth, a dental accident, trauma, or an old filling that has fallen out. That's the usual, or sensitive tooth necks, and so on. Statistically, that's still actually the most common reason, just an acute dental problem. But in fact, there are people, especially those who are a bit more sensitive, I would say women, perhaps more often, who simply notice, often also around the time of menopause, that something just isn't running as smoothly anymore. And that ultimately, perhaps due to a certain backlog of dental work, they simply have accumulated dental problems and somehow generally notice that something isn't quite right. And of course, silent inflammations are present. That's actually the main factor. Most of the time, these are of course lingering issues that have developed over years, if not decades. And at some point, people simply feel the need to really resolve this fundamentally. Maybe a small incident is added to that, and perhaps also an aesthetic deficit or minor issue. And that simply leads people to finally tackle things fundamentally. And when you then essentially diagnose things and really go through and analyze everything thoroughly, then it often becomes clear that people say, yes, that's true. I've always known that anyway. And yes, I've known that for a long time, but now we're finally going to address it. And of course, that's good on the one hand. And they also notice that somehow their life energy and let's say chronic fatigue, people develop that more often too. So their overall life energy decreases, and maybe also some aesthetic problems or chewing problems or something else. This combination of factors then leads them to finally tackle things now. And in conversation, it almost always turns out that, strictly speaking, they've known for a while that this has been a problem and that they've often neglected it through their own fault. And maybe that's my appeal based on practical experience. You can fix a lot of things and often it becomes quite extensive and costly. It's actually smarter if you make sure through regular recall appointments that hardly anything comes up in a figurative metaphorical sense, meaning that major damage doesn't even occur in the first place. That is definitely, in the end, also more affordable, and above all, it prevents fundamental damage, or at least most of it. Not everything, of course, but the majority. And that would already be the better strategy.
To touch on the topic of silent inflammation, from your perspective, are there typical blood tests that make sense to do? Are there also indicators that show you have a silent inflammation?
Yes, of course, there are inflammation markers like CRP, for example, or high sensitivity CRP. The thing is, these markers are not specific, for example, to dental and oral situations. Of course, in cases of periodontitis, apical inflammations and other issues, CRP or high sensitivity CRP is often elevated, but it's just not specific at all. That's why it doesn't really help us that much. It could also be caused by other inflammatory processes in the body. Of course, there are also measurements such as AMMP8, things like that, matrix metalloproteinase, the activated form, which simply indicates collagen breakdown, specifically also in the oral cavity. But even that is only partially specific, of course. So there are indeed some indicators, but the clinical picture, meaning existing gum bleeding, bone loss, and so on, is of course another matter entirely. Yes, more tangible in the truest sense of the word. Blood tests still make sense, of course, because you can often use them to detect certain deficiencies. For example, a key point would be a low vitamin D level, which can easily be measured, or of course other micronutrients, vitamins, and so on. These can certainly be measured, though sometimes it can get a bit expensive, especially if you measure a lot and do it regularly, because these are just snapshots. But especially the basics like vitamin D levels or an omega-3 index, this fatty acid index, those are important because they reflect the overall supply, for example, for the immune system, but also for bone metabolism, for healthy bone metabolism, and for example, for the general level of inflammation throughout the body. These can, of course, be roughly assessed, or you can determine if something is clearly not optimal here, that there may be a hidden factor involved. And then you can get this into the green zone relatively easily, quickly, predictably, and also quite affordably, as I call it, so that this is no longer an issue. And that also helps with the effectiveness and success of the therapy. So if I have an optimal supply of all vitamins, micronutrients, amino acids, omega-3 fatty acids, vitamin D levels, K2, vitamin C, and so on, zinc, selenium, and all the others, then any therapy will also be more successful because it's not just a mechanical piece. Stone, or rather tooth and tissue that just gets scraped off somehow, and then somehow it will work out. But in reality, every system is different, and we simply have to make sure that the systemic factors are also optimized so that the local therapy, in terms of the biological reaction afterwards, works optimally. And conversely, if all the parameters are in the green zone, thanks to optimal nutrition and so on and so forth, then the susceptibility for periodontal diseases like periodontitis to even develop in the first place is much lower. So both for curative purposes, it's better, and for preventive purposes, for avoiding issues, it's important that everything is in the green zone.
In your book, Silent Root Cause, you very impressively show which causes there are for the development of silent inflammations and how these can also be optimally treated in a very holistic way. You've also been an all-rounder for over 30 years, well, 20 years, a specialist in ceramic implants and biological dentistry. From your perspective, is there a current trend that you notice when patients come to see you? Are there any particular patterns, or has the development actually been relatively the same over the past years?
The fundamental problems are always the same. Of course, that's true in every country, in every region, in every practice, in every city, village, country, city, big city. In every society, the statistical distributions are naturally a bit different. And of course, that's also true in every practice. That's clear? The fundamental problems are the same. That's why it's so easy to keep saying the same things over and over, because in fact, prevention would prevent an enormous amount of harm, and it would also significantly improve metabolic health and overall longevity. That's why we've been preaching this for decades. Unfortunately, not everyone always listens optimally or reflects on it. You just have to say that. There is a certain proportion, maybe a third to half, who respond very, very well to it and manage it very well with our professional help. And that's really wonderful because it shows how well the concept works. But there are also, in a certain way, people who are resistant to advice or very undisciplined, who just keep falling for the same things over and over again. And then it's always a real shame when you have to take major measures afterwards, even though you could have actually prevented it at the root cause. But the question was, does the same thing keep happening? Basically, yes, maybe distributed a bit differently statistically. So what are the main underlying problems? Ultimately, the consequence of caries And what is that? Eventually, dead teeth, root canal treatments, and then, due to certain failures of root canal treatments, inflammations around dead roots. This has been a constant issue in dentistry for centuries, but definitely for decades. Especially from a holistic perspective, we know that there are a lot of systemic collateral damages over time. So it's not just about whether someone has a toothache or not, but rather what does a dead, ultimately partially decaying organ or remnants of organs, in other words, dead expelled teeth, do within the body. And it's also not the case that everything is the same for everyone. So one size fits all definitely doesn't apply. Instead, it always needs to be considered in a differentiated, individual way. And it can also change, the situation can change over the years. But this is a huge problem simply empirically as well, because it happens very, very often. In Germany alone, according to rough estimates, between 11 and 14 million root canal treatments are performed each year, simply because it was always too late. Of course, that's a shame in itself, because ideally none should have to be done at all, since everything would remain healthy. And that simply leads to the long-term consequences are unavoidable. And not because there is necessarily malpractice or poor treatment by doctors, but because it is inherently a problem. Endodontic treatments are, in the long run, usually a problem. Of course, the techniques and methods have improved significantly over the decades. That's true, but it's also very costly if you want to do it optimally. It is very time-consuming and also material-intensive in a certain way, and it also results in high treatment costs. That's why, once again, the cheapest option is always to avoid cavities. Then you won't need a root canal treatment later, unless an accident happens, of course. So, endodontic problems are empirically a huge field, and of course the perennial issues are things like periodontitis. Gum inflammation and periodontal disease are truly widespread diseases. About 50% of all adults are affected by it to a greater or lesser extent. It's a huge topic, especially because of its systemic effects. For overall health, cardiovascular issues are significantly increased as a risk factor, so the tendency for heart attacks is clearly higher, the risk of stroke is clearly higher, the tendency for diabetes is clearly higher, and many, many others as well, such as joint diseases, neurodegenerative diseases, which are very important, of course. And naturally, in the age of implants, peri-implant diseases are also a concern. This is essentially the counterpart to periodontitis, the inflammatory destruction. When it comes to teeth, it's periodontitis. When it comes to implants, it's peri-implantitis. And this is, of course, a huge problem empirically as well. You can already see this from the fact that major dental congresses and continuing education events have had to focus intensively on this topic for the past 20 years, in quotation marks, simply because it is such a major issue. If everything worked perfectly, this issue wouldn't even exist. So these are basically the main perennial topics. And of course, aesthetics and other complaints, or during the menopausal stage of life, naturally also immunological imbalances, burning mouth syndrome, and CMD, that is craniomandibular dysfunction, which covers all these jaw joint and tension issues, are definitely topics as well. It's also a topic because, of course, in times, the age of transformation, and in difficult times now here in Europe at least, but also in other parts of the world, of course in recent years, at least since COVID, due to this whole mix of factors, fear, alarmism, uncertainty, risks, economic problems, deprivation of freedom in a certain way, and many, yes, truly, fundamental existential fears and difficulties are simply arising much more often. Craniomandibular dysfunction as a consequence. Of course, many other problems arise as well, but this one is also becoming a bit more common.
We will go into more detail about this in the next episodes. May I perhaps ask you, in conclusion, one of my central questions is always, what does true longevity mean to you in relation to a specific topic area, so to speak? How would you summarize in one sentence, based on everything we've discussed today, what longevity specifically has to do with teeth, or rather, what significance can be attributed to it?
Longevity as optimal long-term health and thus quality of life is practically the goal. And the dental jaw system simply plays a key role in this, a significant, often underestimated importance. That's the point, and since we happen to come from this field and know it quite well with a lot of experience, we know that we can contribute disproportionately to longevity. Thank God. That's really a wonderful thing. And we often experience this as well with the patients, because they simply report, and we've also conducted our own studies on this, that after comprehensive restorations following a biologically holistic metal-free concept, they not only experience more joy in life thanks to improved dental aesthetics and perhaps better chewing function, but of course also because the entire inflammatory and infectious burden has been eliminated from their bodies. And they simply have a much better and easier life. Although it's a relatively small area, it has a very significant impact. And that's what makes it so effective and also so important. And even today, it is still very much the case that many people simply aren't aware of all these complex connections, which are in reality actually quite straightforward and easy to understand.
I can only confirm that. After all, I originally come from banking, the stock market and business, so to speak. And I didn't have much to do with this topic either until we eventually met. So to sum up, the mouth is a very important longevity organ that ultimately requires special attention. And in our next episodes, we will dedicate ourselves to this topic and also provide listeners with opportunities and concrete points of reference for dealing with it.
Maybe you can break it down very simply. None of this is really anything new. This has been known for a long time. In the past, at horse markets, those interested in horses would always look a horse in the mouth. That's why there's the saying, don't look a gift horse in the mouth. But what am I getting at, or what is my point? Ultimately, a horse's dental and jaw health is of course also a matter of quality, the ultimate marker. How fit is the horse? What is its value as a workhorse, as a riding animal? How much longer will it last? How much longer will it live? How much longer will it last? How long will it still be useful? You use that, and that's why it's ancient knowledge, something that's been known for ages. And in a way, it's a bit like that for us humans too.
A very nice example. We'll come back to that in one of our next episodes. We're wrapping up for today, and I'd like to warmly invite every listener to join us for the next episode, where we'll be discussing a really great and interesting topic, namely how to get rid of belly fat and what that actually has to do with teeth. With that in mind, we're looking forward to having you join us again.